Okay, good evening, everybody. Thanks for joining us tonight. Welcome to our webinar on the use of masks and today's guidance from the CDC about the wearing of cloth face coverings. My name is Tim Hyder. I'm the Public Information Officer for Clackamas County. I'm here with Dylan Blaylock, also of Clackamas County. And I'm here with the three health officers from the region, Dr. Christina Baumann of Washington County, Dr. Sarah President of Clackamas County, and Dr. Jennifer Vines of Multnomah County. Each of them will speak to you today about today's guidance and regional health recommendations. We'll have the health officers speak first, and we'll take questions from the media, and Dylan will explain how that works when we get to that part of the conference. So we'll start things off with Dr. Baumann.
Thank you, Tim. So today the Centers for Disease Control and Prevention came out with new guidance that we should wear a cloth face covering in public places when physical distancing measures are difficult to maintain, such as in a grocery store or in a pharmacy. We're here tonight to discuss this new public health recommendation, and more details about implementation will come over the next few days. So to start, first, why did the CDC make this recommendation for the general public? Recent studies show that people with COVID-19 can not show symptoms, or they can have mild symptoms, but still spread the virus to others. If we wear face coverings, we decrease how many droplets we release when we sneeze, cough, or speak. If we have no symptoms or mild symptoms, wearing a face covering will help us from unknowingly spreading infections to others. So, in other words, when I wear a face covering, I protect you. And when you wear a face covering, you protect me. This is one more thing that we can collectively do to protect each other. The most important step to protect yourself and others is to continue to follow the physical distancing guidelines. Face coverings are not a replacement for this and should not give people a false sense of security. It is critical that you continue to stay home as much as possible, and if you must go out, keep about 6 feet from others. Cover coughs and sneezes, avoid touching your face, and wash your hands frequently. If you are sick, stay home and away from others in your household to protect them. These are vital steps we all must continue to take. Face coverings supplement these actions. To be clear, the CDC is not recommending that the general public wear what we've come to know as masks, and Dr. President is going to speak more to that.
Thank you, Dr. Baumann. I want to reiterate that we are not recommending that everyone in the general public wear masks. Medical masks or N95 respirators must be reserved for healthcare providers who are on the front lines working to protect us all. And it's crucially important that our healthcare workers have the equipment that they need in order to do their jobs. We did want to take a minute and show you the difference between different types of masks and what we're talking about when we use these terms. So an N95 mask or respirator looks something like this. It is something that healthcare workers are trained very clearly in how to use. It fits on the face with elastic bands around it and makes a tight seal so that airflow does not go around the mask. It's made out of very specific materials that filter out the majority of large and very small particles that could be carrying disease. A surgical mask or procedure mask looks something like this. This also covers the face, can tight around the nose, but there's airflow potentially around the sides and even on the bottom. These have less protection, but still filter out many of the viral particles and the droplet particles based on how they are made and certain special fabrics that are used in them. These types of masks are very important and in shortage for our healthcare personnel. If you have masks like this or the N95 respirators, we would ask that you donate these to your counties so that they can be distributed to local healthcare personnel. Each of our counties' websites has a link to how to donate personal protective equipment such as these masks. So what is being recommended today is more of a homemade face covering. So there is limited science around what is going to be most protective. What we can suggest is that the tighter the weave, like thread counts on sheets, the thicker the cloth, the better it fits your face, the better the protection. So people could use something like a bandana. If you use the bandana, just open up. It's not very thick, and you can actually see some light through it. We recommend folding it at least 2, if not 3 or 4 times, but to a point that it can fit securely around your face without a lot of airflow around it. These fabric masks or other face coverings that you use should be changed when they are moist, and they should be washed after every use with warm water and detergent. Masks do not work very well if they're soiled or damaged. Cloth masks or facial coverings will also not benefit you if you cannot breathe easily through them. Limiting the airflow could lead to things such as anxiety, difficulty actually breathing, or possibly trigger coughing, which increases the spread of the virus even when wearing a face covering. They also can be itchy. You want to be careful that you are not adjusting it, and you need to avoid reaching under it to touch your nose or mouth. And remember that the virus can spread by unwashed hands. So common products such as bandanas or scarves or ski masks can be used as face coverings. Homemade cloth masks may be more comfortable and have a better fit. Patterns to sew your own mask can be found online, and there are several volunteer groups that have been producing masks in the metro area. In the coming days, public health departments will be evaluating needs for any changes in our current distribution plans around cloth masks. I'm going to turn it over to Dr. Vines here to close us up.
Great. So good evening, everybody. Thank you to my colleagues in Washington and Clackamas counties, and thank you for those who are able to join us tonight for this important update. This is a change in recommendations, but I want to really emphasize what my colleagues have already said, which is that a face covering does not replace staying at home and staying away from others and staying home, especially when you're ill. So please do not interpret this recommendation as okay to go out as long as you're wearing a mask, or okay to go out if you're sick as long as you're wearing a mask. We continue to emphasize that those are by far the most important measures that we have in place, is everybody continuing to keep at least a 6-foot distance from others, only going out for essential needs. And absolutely, if you are ill, you should be at home. So again, if you're going to use a face mask that you're going to make yourself, it should be clean. You should be careful not to touch your face to adjust it. You want to be using good hand hygiene if you're going to be touching your face to adjust it. And again, if you are sick, I would say this is not an option for you. You should be staying at home, and everybody else should continue to follow our statewide stay-at-home orders.
Thank you. Thank you, Dr. Vines. Thank you, all of the doctors, for presenting tonight. And at this point, we're going to turn it over to any questions that come in, and my colleague Dylan Blaylock.
Hello, members of the media. Dylan Blaylock with Clackamas County. If you have a question, then just go ahead and utilize the raise hand button on Zoom. That can be on the top or the bottom of your Zoom bar, depending on your device. But I see we do not have any calls on the phone. Okay, we're starting to get some raised hands, and I will go ahead and choose one according to your handles. We will try to get through as many as we can. First up is going to be Julia Silverman. Julia, go ahead, and if you can unmute yourself, and you are on to ask your question.
Hi, thank you all so much. And I apologize if you said this before I got to the meeting, but does this apply only if you're going inside, like to a grocery store or to a pharmacy? Do you also need to wear a mask if you are taking a walk or a run, as has been told that it's okay still to exercise and be outside in fresh air for limited times during the day? Thank you so much.
Who would like to handle that?
This is Dr. Baumann.
Thank you.
Yeah, so thank you for the question, Julia. I think what the CDC is really trying to get across is that if you cannot maintain the physical distancing measures, then please wear a cloth face covering. So that could potentially be outdoors if you're in a crowded setting for some reason, but also could be indoors, such as if you need to get close to someone to get by them in a grocery store aisle, etc. So really the main principle is if you can't maintain that about 6-foot distance from another person.
Okay, great. Thank you very much, Julia, for your question. Next up is going to be Megan Trihe. Megan, if you could go ahead and go ahead, you are on.
This is actually Lincoln Graves. I'm logged in under Megan's name with
Okay.
KU News here. I do want to ask, what if people, they go out without a mask? Certainly people will then see them not wearing a mask. And in light of this new guidance, is this going to almost be like, are they being viewed as doing something wrong now if they're not wearing a mask when they're out in public?
Dr. President?
Sure, I'll take that. We in public health at this point do not have any plans for enforcing this as guidance. This is really just a recommendation that everybody do everything that we can to continue to help flatten the curve and decrease the spread of this disease. We do have new information that there is more potential to spread the disease before you have symptoms than we previously thought. So wearing the mask helps prevent asymptomatic people from shedding the virus to others. I think that the way that people treat each other in our metro region has shown to be really heartening. I think there are a lot of people who are treating each other very well, who are banding together to help our community and help each other and help those in need. There is no recommendation that people call 911 or call public health to report people not wearing masks. Try to keep your 6-foot distance and try to be kind to your neighbors and try to educate your neighbors and your loved ones and your community in ways that is positive and moves towards our ultimate goal.
All right, thank you very much for the question. Next up is going to be Jenny Young. Jenny Young, if you can unmute yourself.
Hi.
And you are on.
Hi, everybody. Thank you so much for doing this tonight. Okay, so we would like to know over at COIN, how do you properly dispose of these? Or if you're doing the homemade masks, the cloth masks, how do you clean them properly and how often?
Dr. Vise?
Sure. So the medical masks that Dr. President showed, those are intended to be single use, although we have health systems that are using them longer than that in order to conserve. I would say for people listening and thinking about making their own masks, they would want to make sure they're washable and laundered at least once a day. And you really shouldn't be wearing it if it's dirty or soiled. Is that your entire question?
Yes.
Yeah.
Okay. Well, I mean, if you laundered once a day, but I mean, would there ever be a point where you maybe needed to launder it more than once a day? I mean,
yeah. Thank you. So soap and water. So basic laundering is key. If it is obviously wet or soiled, it should be laundered, and you should swap it out for a fresh one, or wait to clean it before you use it.
Okay, great. Thanks very much. The next question is going to be from the handle is M. Benner. M. Benner, if you could go ahead and, okay, you are on. Go ahead.
Hey there, Mike Benner with KGW News. Second, Jenny, thank you for doing this tonight. Dr. Bauman, I think you maybe touched on this and maybe you can elaborate a little more, but from what I've been reading, and correct me if I'm wrong, wearing a mask doesn't necessarily protect the mask wearer, but it protects others you're around, correct? Isn't that the idea of the mask?
Yeah, and so some of our terminology you'll notice is shifting. So CDC uses the term face covering to distinguish from medical masks. And yes, we are not at all advising our healthcare workers to use face coverings because we know that they don't meet the infection prevention standards to keep them healthy. The cloth coverings really are intended to block droplets from people who might have COVID-19 and be asymptomatic or have mild symptoms and not yet know that they are on the road toward getting sick because they are thought to be contagious at that point. So yes, your statement is correct. The face coverings are intended to protect others. And that's why it's more of a collective approach that we all wear them to protect each other.
All right, thanks very much for that. The next one is, I'll remind everybody in the, all members of the media, if you have a question that you want to ask, go ahead and hit the raise hand feature on Zoom. That can be on the top or bottom of your device. It's in the Zoom bar. The next person we'll go to is myoung.oregonian. Let me unmute you. I think you have to unmute yourself, myoung.org. There we go. And now go ahead, you are on.
Thank you. This is Molly Young at the Oregonian. I wanted to follow up on something that Dr. Present had mentioned regarding counties evaluating possible distribution. Can you tell us more about those efforts and what is being done to make sure people who don't have access to face coverings are getting them?
Yeah, thank you for that question. So this is new guidance from the CDC, and we are still putting together the plans for how to ensure that everybody has access to what they need to stay healthy and safe. Again, I can't reiterate more that staying home when you're ill and keeping our social distancing is the primary way of preventing the spread of the disease. That being said, the emergency operations centers from all 3 counties, I believe, are taking donations and have been taking donations even of cloth masks already. We have plans in place already for distribution of these to some of our higher risk, more vulnerable populations, such as in shelters, where we know that the spread of the disease could have pretty drastic effects in the communities, and that these cloth masks may be really a good protection. As far as getting it beyond those special populations, we all need to work through our emergency operations centers and clarify those plans. But I do believe that in the next coming days, since this guidance is out, we will be looking into what the needs are in the different communities.
Okay, great. The next one we have is just the handle KPTV News. So, oh, 1 second, it moved on me real quick. KPTV News. If you could unmute yourself, because it looks like I cannot. There we go. And just go ahead. Oh, we are not able to hear you, KPTV News. We've had problems with this before. If there's a microphone issue on your end, but you're unmuted, so still not able to hear you. If there is anyone, I'll mute you for a second just to see. If there's anyone else who is interested in giving a question, that was the last hand raised. So if you want to ask a question, please go ahead and raise your hand via the raise hand feature on Zoom. It's in the Zoom bar, top or bottom of your device. KPTV News, let's try you one more time. I'm sorry, we're not hearing any of you. I believe this must be a microphone issue on your end. If you want to try a different computer or something like that, please do. But we'll go on to, it looks like Jenny Young. Jenny Young, go ahead and.
This isn't a question about masks, it's about PPE, but while I have you all on here, I'll take advantage of the time. I've had a couple of people ask me this week how the best way to get a hold of healthcare workers if they want to donate PPE. There's, one company specifically that is able to make, a couple of thousand masks a day, but they're having a hard time figuring out how to donate and who to donate to. And I know that I think it was Dr. Present mentioned that there's links to that on each county's website. Is that the best way to go about that? I know that there's been a lot of confusion about that from the beginning.
Go ahead.
Yeah, so in I believe in the press release that we sent out, there were links to each of the county's websites to where people can get information about donating. There's also the Emergency Operations Center for the state of Oregon has a website to coordinate PPE that then can be distributed across the state. So there are options, and there should be links on the website. And if you are having trouble getting those, then I would refer you to the county's PIOs, and we can help direct you in the right place.
Yes, that's right. On the advisory that went out today, all of our contact information is out there. But as Dr. President said, it's very prominent on all the websites where you can donate and how you can donate, and it's certainly welcome.
And I was just going to add that the state website also has an option for vendors. So anybody who thinks that they can scale up production of healthcare level gear, I believe there's an option on the state website for that.
Okay, great. Thank you very much. I'm going to go ahead and try KPTV News one more time. KPTV News, if you could, okay, you're unmuted. Can you say something now? Still not quite working there. I'll tell you what, KPTV News, if you can send me an email, I can go ahead and relay your question while we get through one more question after you. Again, you can send an email to me and I'll relay it. My email is dblaylock. You can see my name on the screen there. It's D as in dog, BLAYLOCK @clackamas.us. Again, dblaylock @clackamas.us. And I can go ahead and try to relay your question that way if you get it into me pretty soon here. So next we will go to, oh, it's back to M. Benner. So I think it's Mike. Go ahead, Mike.
I have a question as far as children, because, you know, and forgive me if you've touched on this, when I was navigating the screen, I might have missed a couple points you made, but, you know, not every parent has the luxury to leave their kids at home if they have to run into the grocery store real quick, you know, say a single parent for that. Is there a recommendation as far as masks go for children? Should they be in masks as well?
This is Dr. President. I have not heard any specific guidance for children. I think that there are several face coverings that are appropriate for children to use, depending on age. So ski masks, bandanas, some children would do fine with that as far as very young infants and toddlers. Again, keeping the social distancing and just doing all that we can to help protect the spread of the disease is going to be what helps us. I think that everybody should just try to do their best, and we don't have any specific guidance for small children.
Okay, thanks very much for that. And we have another question from, I'm sorry, I know it's Megan Tryhe is the handle, but I know it's somebody else, if I'm remembering correctly. Go ahead.
This is Lincoln Graves from K2 News. I just wanted to ask, obviously this is kind of a big shift from what we heard in the beginning of this pandemic. So I'm just wondering, what would you say to everyone out there? Is this normal to have such a big sort of guideline shift in the middle of something this large? And I realize we're not laying the blame on any local officials. This is new stuff from the CDC, but just talk about the big shift here and how we came to this point when we weren't there a few weeks ago.
Dr. Vines?
So I'll take a stab at that question. It's a great one, and I'll let my colleagues comment as well. You're right that a few weeks ago we were pointing out what is still true, which is that there's not a lot of science behind cloth masks. I think given the scale of the pandemic and the way that it's unfolded elsewhere, I think there's a real sense of urgency to do everything we can to prevent spread. So again, that's the staying home except for essential trips, that's washing hands, staying home if you're ill. And now this additional recommendation that we think offers some benefit in containing droplets and potentially for those people who may have the virus and not be showing symptoms. Again, when we put these things in place across the population, we hope that we succeed in just slowing the spread of the virus and really spacing out those severe cases that we're concerned are coming in the next few weeks. And I'd be glad to hear from my colleagues as well.
Dr. Bauman?
Yeah, I think too what has been a continuing theme is that we're always learning new things. There's always new information coming out, and so the new information in front of us now is that asymptomatic infections and mild infections may be more common than was previously thought, and may be part of the contributing factors to spread of this infection. And so for that reason, taking the additional precaution of wearing face coverings when we're out can address the gap in that time before we know that we're sick, and then would then be prompted to take the additional measures of staying home. So like Dr. Vines mentioned, this is additive, and we are trying to do everything that we can to slow the spread down.
Yeah, and I'll just finish that out to say that there's nothing usual about such unusual times as this. This really is unprecedented. We haven't had a pandemic like this in 100 years, since 1918. And a lot has changed since then. We've known from the beginning that information is changing rapidly, and that it's an evolving situation. So I think that to have new guidelines coming out as science grows is something that was not unexpected, and we can anticipate potentially more changes as we go forward and learn more.
Okay, we actually did get that reporter to email in the question that they weren't able to get in, and we had somebody else follow up with another question. I'll remind reporters, if you can go ahead and hit the raise hand function on Zoom, but this one comes from Audrey Wheel at Fox 12. Her question was, I've read that face coverings can help prevent the spread when it comes to coughing, sneezing, and speaking. Is even talking in close proximity a concern at this point, and a contributing reason for implementing this mask recommendation?
Dr. Baumann?
Sure, I can start with that question, and if other of my colleagues want to add to it. So whenever we do anything that causes us to forcefully exhale, we are putting out droplets. So we know that sometimes we spit when we speak, and so that is a more obvious way that we're doing that. And coughing and sneezing are certainly much, much more forceful than just the process of speaking. So certainly we have looked at coughs and sneezes as the greater risks for transmitting droplets and virus to people around us, but we also need to recognize that just the action of speaking can do the same.
Dr. Vines or Dr. President?
So I'll just add that the intimacy and the close proximity of speaking is a concern. That's why we're asking people to stick to their immediate social circle and households where that intimacy is already established. And that's why we're saying for everybody else, you should be 6 feet apart. And now we're saying if you can't do that and you must be out, then please cover your face. Again, kind of the final level of protection.
Great.
Okay, and the other question that we got over emails is from Aaron Hackett. Are you recommending or asking that essential businesses allow, let me try to restate this. Are you recommending or asking essential businesses allow employees to wear masks?
Dr. Baumann?
So this guidance is new, and we are evolving in it. I think that making a distinction between medical masks and face coverings is important. We definitely want to underscore that medical masks and N95 respirators are in limited supply, and we really need to conserve those for our frontline healthcare workers. That said, face coverings are something that are being asked for the general public to wear when they cannot maintain their social physical distancing. And so I think that as we adopt these recommendations and think them through, employers will need to work through whether it's reasonable given the workplace practices to have their employees wear face coverings. This right now is a recommendation coming from CDC, and it will be adapted to policies and workplaces over time, potentially.
Dylan, how are we doing on questions anymore?
We do not have any more hands raised, so last call. Anybody who wants to go ahead and ask a question, please use the raise hand feature now, or that's gonna be it. Give it 5 seconds here. All right.
Okay, I want to thank the health officers for their time and expertise tonight and their very generous advice to all of us and for bringing us through this guidance. I want to thank the media and those who attended and for asking questions, and just understand this is a rapidly evolving event, and I'm sure there'll be further guidance as we go forward. So thank you all. Have a great evening and have a great weekend. Stay home and stay safe.